going to talk about handwriting techniques and how we can do a better job of teaching handwriting to our kids. The International Dyslexia Society has published risk signs that we need to be aware of when we're evaluating our students who might have potential handwriting problems. They often lack fine motor skill They often lack in the fine motor skills problems. They just don't have the right skills automatically coming in to perform these fine motor skills like handwriting effectively. Sometimes they lack dominance in their hands. They might not always use the same hand. They might change it up, and they need to have a little guidance there. They have reversals of letters beyond the early writing stage. The D, B, all the letters that could potentially be reversed, nines, numbers that are reversed, just a lot of the numbers that they generally reverse. If they're doing that past just the first stages, definitely something that needs to be looked at. Some of these kids can have a poor pencil grasp. Possibly they just were never taught it, so they are just kind of going with what feels comfortable, but sometimes there's more of an issue there. They have spatial problems, and this can just affect how they put things on the paper. They often have a slow rate of writing compared to their peers. So of course when they're learning writing, it's going to be slower, but as their peers start increasing in speed, a lot of times kids with dysgraphia do not. They have inconsistent spacing of letters. They also have inconsistent spacing between the words. So sometimes their space might be really big between letters within a word, and then sometimes they might have a really small space between words. So it's just really inconsistent and lacks them even paying attention to the spacing. They lack automaticity of just writing their letters. They have to sometimes think more of how it should look. Which also sometimes leads to excessive eraser marks on their page. These kids often write stuff, erase it, write stuff, erase it. So that's another sign. Poorly connected cursive letters, if they are learning cursive. In our U.S. schools, a lot of these schools are not even teaching cursive to these younger children, but poorly connected letters, if they are learning cursive, is often a sign. Hand fatigue. If they're constantly complaining about their hands hurting and they haven't really written a whole lot, that can be a warning sign. Also, the inconsistent slant of their letters. Sometimes they're holding their paper one way, sometimes it's another way, and it makes their letters look different at different times. There are a lot of handwriting interventions that can be done. The first thing someone who's doing interventions needs to do is to find hand dominance, arm dominance, foot dominance, ear dominance. Sometimes that's not the same. You could have a left foot dominance and a right hand dominance. So the interventionist needs to determine the dominance of all these body areas and encourage them to use them. Get their dominant hand and consistently write with that hand and develop their fine motor skills for writing in that one area. Students can learn print, and often when they're learning their letters, print is what is used. However, the research has determined that cursive needs to begin when reading begins. This is an interesting viewpoint because that's not happening in most of our schools, but the research indicates that if they begin writing in cursive first, it can really help with the dysgraphia. Advantages of cursive is it helps students connect thoughts without starting and stopping at each letter. And it's always moving from left to right consistently. They don't have a letter go back and forth like you do with print. It's always moving forward from left to right. Often kids with dysgraphia and dyslexia have fewer letter reversals with cursive. Letters are not mirror images of each other in cursive. Think of a cursive B and a cursive D. They are not mirror images of each other. So this often helps them with their reversals. Spacing between letters is less of an issue. If they're connecting the letters correctly, then they're not having that random space in between letters, and that helps with their overall spacing between words as well. It's easier to read and write if they're taught the proper techniques. In cursive, if they start that from the beginning, it eliminates the headache of learning print and kind of struggling with print and then switching to cursive. So just learning cursive from the beginning has a lot of benefits. When they're teaching handwriting explicitly to kids, pencil grip needs to be paid attention to. You should have your pencil between your index finger and your index finger, 3 fingers, just like this. They need to work on this. A lot of times it's just being overlooked in schools, and this is the best pencil grip right here between the index finger and the thumb and resting on the middle finger. That is the grip we're looking for. It keeps tendons from stretching, and it also helps with the fatigue if they have a good pencil grasp. And this is something that needs to start early. Once writing is defined, and it's really hard to take a 5th grader who's been writing all those years and change something that's so automatic to them. So this needs to start early with our kindergarten, pre-K even, because it just gets harder to change as they get older. Interventionists should practice push-pull movements with the pencil. They need to practice just picking the pencil up, making it automatic that they pick the pencil up correctly. Reinforce that they're picking it up correctly as they're learning, where they don't slip into their old habits of how they first learned how to grasp a pencil. Students should not just practice letters. They should practice drawing shapes, coloring in color books with little kids. The younger students love to color in color books, and that is teaching that fine motor skills. That's teaching the pencil grasp, and it's doing just as much to help with their motor skills, their fine motor skills, as letters. So have them practice in other areas as well. Drawing and art really help. Gradually, you need to move to making sure that they have the paper correctly positioned, their posture correct, and this can change based on hand dominance. Your paper needs to be at a 45-degree angle to the desk. So your paper should not look like this as you write. It should be more like this or this, depending on hand dominance. So a person who's left-handed has their paper slanted an opposite way as a person with their right hand. And this should be something that's allowed to happen. We shouldn't be trying to transform a left-handed person to writing like a right-hand person. These are two separate areas, and they should be able to have their page slanted appropriately. Practice basic strokes before letters. Swinging up stroke just looks like a bunch of cursive U's swinging up. A roller skate stroke is like lowercase e's in cursive. Have them just practice those. Hills and valleys, going up and down, up and down. Practice making the hills and valleys consistent. Ocean waves, and just learning how to be consistent. Those are all helping their pencil grasp, and they're helping their cursive strokes. But as you're teaching cursive, it should be done in a systematic way. You shouldn't just kind of throw letters at them and have them do it. They need to master one letter at a time. Be consistent, reinforce, make sure that they have completed a letter before you move on. You want to work with the larger muscle groups before we go to the fine motor groups. Make sure they understand that the letters have sound up with them and understand the sound to symbol relationship. That helps with the reading that will come. First, you want to practice on unlined paper to get them used to just the strokes themselves. And then after they're used to those, you can introduce the lines after the letter strokes are already automatic. Teach them how to correct words right away, the letters in a word right away. Too often handwriting is taught with letters in isolation. With cursive, it works better to learn a few letters and learn how to connect them in a word as they're learning them, because the connection is so important in cursive. Have them practice without looking at the paper. When all letters are taught in the alphabet, time them. Fluency is so important in handwriting and to help our dysgraphia students. When they have learned all the lowercase letters, the goal is for them to be able to write the whole alphabet in 30 to 40 seconds. So if they are taking a lot longer than that, it takes 3 or 4 minutes, even 2 minutes, practice that fluency and make sure they have the fluency before you move on. After they are forming their letters and able to do it at a acceptable speed, it's only after that do you introduce the uppercase letters. So all lowercase letters first. Once they've mastered that and they've mastered how to connect them, then do the uppercase letters. And this is just something that unfortunately is just overlooked in schools. There's such a push for reading in those younger grades that they don't explicitly teach this, and when they do, they often don't have the time it takes to teach this, and then they get in older grades and they lack these skills. And often cursive is not even taught in schools, so it's really something that needs to be taught and it needs to be practiced, because a kid just automatically isn't going to come into kindergarten picking up a pencil correctly. They need to be shown. Doing all of these things can help gen ed kids as well who don't have disabilities, but it definitely will help the kids who have dysgraphia with their reversals and forming their letters and just making them aware of the paper and where things should be written can help a lot. So these are handwriting interventions.